Hello, hello, and welcome back to the Injectors Talk Show. Today I'm joined by none other than Nurse Chiara from the Beauty Standard. She is the owner of the Beauty Standard. She is phenomenal in every single way possible. Her ats are Nurse in the Six and thebeautystandard.ca.
Yeah.
So tell us a little bit more about yourself.
So I've been injecting since like 2012, which is crazy because sometimes I still feel very new. I started working for Dr. Lista back in the day. That's how we got started. There was like no courses to take. You couldn't just, decide you wanted to be an injector one day. You had to like get in with one of the plastic surgeons and
Wow.
start that way. So did that for a bit and worked for another couple of surgeons. And then I decided to go out on my own after trying to work for other clinics that just didn't jive with me. So here we are. I used to rent a room for the last 8 years. And finally, last February, decided to open up my own place, which has been nuts.
Oh, wow.
Yeah, we just
This
opened in February.
2025.
Yeah,
And it's
2025.
grew so much so quick, right?
It's growing. Yeah, I'm lucky that I had a clientele to start with. Now I'm really focusing on trying to get everybody else really busy. Like Nurse Marco, he's amazing, which you've already had to chat with him. And our medical estheticians, like they're fantastic. Dina is just blowing up, and we have Chanel, who's going to be just as amazing as Dina. So yeah.
How do you choose the right people?
Honestly, that's probably the thing that gave me the most anxiety because when I was thinking about who to hire, I was not getting any good candidates. And they were not people that I would trust to work on myself, let alone my clients. And luckily, I had enough time. So I had put out a post because I actually opened up another room in Vaughan, trying to see, like, okay, what location am I going to choose? I'm going to stay in Etobicoke or try to go closer to home. And I put out an ad for an esthetician, and months went by, and I never got any good candidates. And then, like, one random day, Dina like emailed me so professionally with her pictures and everything, and we chatted like immediately. And that was in July, and we didn't open until February. So this girl, like, if it wasn't for her, I could cry because honestly, she's so incredible. But she waited for me. Like, she worked at her other clinic and she really wanted to leave there, but she had faith in me. And I'm just so grateful. So, yeah. And Nurse Marco, oh my God, don't even get me started with Marco.
He loves you.
No, I love Marco. Like, we feed off each other. And like, even the other day, I was doing an IV, which I don't do tons of IVs, especially like I work ICU. Everybody had a central line, but Marco's ER nurse. So I had a problem and I'm like, oh my God, what do I do? Can I poke her again? And he's like, shut up. Yes, you can. Like, just do it. So all the time, it's just like me and him. I love him.
Yeah, he raved about you a lot. Like, he really, really loves
Oh,
you
yeah,
too.
that's awesome. I would be lost
Yeah.
without him. So yeah, that's the key. Like, if you're interested in starting your own place, like, you really need a good team, like people you can trust and people you would want to do like your own treatments. That's like key.
It's really hard to
Yeah.
start. And there are so many clinics, there's so much competition.
Yeah, honestly, if I was a newer nurse, I don't think I would survive in this industry that's now. Like, I think
Hmm.
you need more than just talent. Like, back in the day, word of mouth, like, we couldn't even share photos on
Yeah.
Instagram. Like, that wasn't a thing. I don't even, there obviously wasn't even Instagram, but like,
Yeah.
if you worked for a doctor, like, the photos stayed on the camera. You didn't bring them home. You didn't really do any of that. And now it's all about social media. If you suck at social media, like, you have no chance.
Yeah.
Like, you just don't. I'm lucky that I have a supportive partner, and I'm able to kind of go through the trenches right now. Like, if I didn't have him and I have kids, like, I wouldn't be making ends meet half of the time, right? But I'm lucky that I have that. But I want to create an environment where injectors can flourish and do their own thing, and we all support each other. Like, so you don't have to go and take out loans and like start your own place. I give them the freedom to choose their own hours. Marco has full control of anybody who he sees or doesn't want to see, and he gets to make a lot of the profit. Like, we basically share profit, and if you can't keep your employees happy, then they're not going to stay. They're going to want to go and set up their own. But I'm trying to make an environment where you don't have to. So you don't have to worry about overhead cost. You don't have to kill yourself trying to do something. You have a nice, beautiful environment to do what you want, and he can grow however he likes. So I hope he stays with me forever and we just continue to grow, and eventually like he would have a partnership in my business. Like that's my goal for him. So we'll see.
And if there are any injectors watching, would you be open to hiring any injectors?
Yeah, I get asked this a lot and I see some really good candidates, but like right now I just couldn't. Like I don't have enough clientele to support. It's a slow growth in this economy with all the competition and like all the cheap injectors. Like don't even get me started on that. Like the industry is very different now. Like
Yeah.
very.
What do we do about the $5 a unit? Like I don't understand what they're doing.
Okay, well, this is what I do. I try to educate my clients because they're like, I wanted to bring a friend, but she has this injector she goes to. She only charges $7 a unit, and blah blah blah. She's like, she doesn't look that great. I'm like, well, there you go. She doesn't look that great, and I bet you when she goes to her injector, I can't swear, right? So
You can.
Oh
You
my
can.
that bitch.
Please.
I have such a potty mouth.
I love her. Yeah, I was gonna say with the bleep on the story, I was obsessed.
Yeah,
it was bleep after every sentence.
I have such a bad potty mouth. Like,
no, it's so good.
Whoever that injector is, that bitch is definitely going to be suggesting like 4 or 5 syringes, because if you're charging so little, in order for her to make a profit, she's going to have to sell you more.
Yeah.
So I don't know. You just have to educate your clients and let them go. They always come back because they got fucked up. Sorry.
Yeah. Yeah.
They do.
Yeah.
They get botched.
Exactly. With all those units. And I don't think the Botox is Botox sometimes.
Oh, how many times a day do you get messages from like Korean or these Asian people who are like, oh, we have legitimate this, legitimate that, way cheaper? Like, obviously it's not. Like, it's only going to be reputable if you bought it off of the rep in the company, right? Like,
it's crazy.
But I know some good injectors who are using products that
they're lying about.
Are not legit. So if you want to take that chance and to save, you go ahead, but you're definitely not going to be saving in the long run.
Yeah, not in the long run.
Yeah.
And going back to your husband and how you balance work, being a mom, being the most beautiful wife, and going to the gym. Like, guys, she is like stunning in real life too, and her skin is glowing.
Yeah, that's because I do everything to my face. But
you just did the Botox, right?
No, I just did the stamping, like the micro stamping.
With the Botox or no?
With Botox, a little bit, yeah. But I just did it yesterday, so I don't know if that's kicked in yet. But I do something like, I don't know, once a week. Whenever the girls have time, I'm like, okay, what can we do? I don't think I do balance it. I'm still trying to figure it out. Like, I have no social life, so that helps. I had enough of a social life before, for especially everybody who knows me from before. I had a good time. I'm good. I'm happy to go home to my husband and my kids and just chill. Like, that's it.
Yeah. So you don't balance it. That's the answer.
I don't think there is a balance. Like, eventually one day there will be, but especially right now, like just grinding and trying to, like, the first year of business, I don't know how people do it or do multiple businesses. Like, you guys are crazy, but it's rough.
Yeah.
Yeah.
And what treatments do you do for your husband?
Well, he just started to get Botox, and only Marco will do his Botox because I refuse to touch him. Like, he's gonna complain or like said I made him blind or something ridiculous. So I thought Marco is so great at handling people like him. But yeah, he finally started getting Botox, and yeah, he looks a lot better in my opinion. But
yeah. Any facials, any skincare for men that you recommend?
I bought him skincare. He doesn't use it, but he went for a facial with Dina, and I was like, what did you do to him? Why does he look so good? She's like, girl, I just like washed his face and did some extractions and put a serum on. I was like, sometimes that's all you need.
That's all you need.
Yeah.
And for men, what do you find that there's the most common treatment they do, or what do they need?
A lot of men do Botox once their wives or girlfriends kind of nudge them to come in. And I would say the second most popular treatment that I do for them is tear troughs. So we do all the tear trough filler. Especially men have like that nice thicker skin. So I feel like they're generally a better candidate for it.
Mm-hmm.
Yeah.
And do you find that people are steering away from filler? Do you still recommend it for them?
Yeah, I mean, definitely people are scared of filler. Yeah. And how could you not be with all the disasters that walk around all day long? Like all you see is the bad filler, right? The good filler you don't see. So yeah, people are scared, but I'm very conservative, and I believe that like putting fillers strategically in the right place for the right candidate is amazing. So when I talk to them, they're usually down to do it, and they keep coming back because they like it. They look great, so I'm
Yeah, they
happy.
do look great.
Yeah.
And do you do the medial cheek as well for them with the tear trough filler?
For men, to be
Yeah.
honest, my clientele, they want, especially the men, like for me to even like convince them to do tear trough filler is already enough. So even though doing a little bit of medial cheek would probably help them, I'm doing whatever's like best for them, and most of the time I don't have to.
Okay.
Yeah.
And it's been good, right?
It's been
You've been doing
great.
it for years.
Yeah, I think men, like especially the men that I see, they're not trying to look beautiful. They just feel like they look so tired and they just want that improvement.
Yeah.
They're not too concerned with like volume loss or like, yeah, we can help support it, but I think the idea of cheek filler for them is just like a no.
Terrifying.
Yeah.
And how are they handling the pain with the tear trough filler?
They are the biggest wimps all the time. Like I have to have the juice box ready alongside injecting. I also worked at Sick Kids in the ICU up until 2020 was my last time there because I got pregnant, and then I got pregnant again back to back.
Nice.
So yeah, that was my last time there, but I was there for 12 years. Sick Kids has flexible scheduling. And when I worked for Dr. Lista, he was also pretty flexible with me. So I worked 6 days a week and I just did both. Wow. And I just continued to do that. My plan was always to get into aesthetics. Like that was the goal, but I ended up getting like a really good job at Sick Kids that I couldn't pass down. I ended up really liking it. So I just did both.
So good. Yeah. I always wanted to work at Sick Kids. It's the best hospital.
Yeah, it's great. It's great for sure.
It's tough. It's tough with the kids.
Yeah, if I went back there now, I think I'd be like a baby. I'd probably cry my first shift, but I don't know.
I cried. Yeah, when I was at Mount Sinai in the antenatal neonatal unit.
Yeah.
When I saw the first delivery of a dead baby.
Oh yeah.
Ooh.
Yeah, it's sad.
That was the worst. I'm like, maybe I don't like this unit.
Yeah. It really depends. Like when I didn't have kids, it was different for me. Like I felt sad, but I just did it, and I felt really good like helping them in their time of need. And we were cardiac critical care, so a lot of them didn't do well. Prognosis was not good long term, but like to give that little bit of happiness to those families during that time is like really, it was really nice.
What's your secret to building long-term patients?
Honesty.
Yeah.
I say no a lot, like a lot more than maybe I should. But I think that's what keeps people coming back to you, is because they know that you're not just trying to sell them. Like in this industry right now, I think people have like lost their morals and their ethics. And I think that's the number one thing that keeps them coming back to me.
Mm-hmm. Yeah. And do you have mandatory 2-week follow-ups or 4-week follow-ups?
For new clients, I do, especially if we're doing talks, because like I think everybody needs a touch up after talks. Like even when I do my own, I do it in stages because it can be really tricky on the forehead, and especially with somebody who has similar anatomy to me, like straight brows and deep set eyes. Like the slightest bit too much can just make you look like I'll say the other one, like a Neanderthal or something like that. I was thinking of something else, but I don't want to say it. But yeah, so those people mandatory. After filler, I usually suggest 4 weeks, especially if they're new. If they're my like current clients, like I just tell them, send me a photo, let me know if you need to see me. But if they don't want to come back or they're good, I don't force it.
It's really tough to get people to come back, right? With scheduling.
Yeah, but when you tell people how important it is, I always say to them after Botox, like you might think it looks okay, but I might be able to make it look better. And that usually is like, oh, okay, coming back then. Mm-hmm. Yeah.
Is it tough to get your clientele to see another nurse injector?
You know what? I thought it would be. I would say some are a little bit hesitant, but they know like if you said he's good, then I'm going to trust you. So a lot of clients have gone to Nurse Marco, and some of them haven't gone back because he's so great and he's so gentle and he's really good at explaining things. And sometimes my patients are less than, so he's really good at like taking his time. And yeah, so
I love that.
Yeah,
he does explain everything very thoroughly. How do you handle unrealistic expectations? Same as you answered, the honesty, or?
Oh yeah, I used to have more patience for that, but I'm just really real. I'm like, it's not gonna happen. Like half of these times they're showing me these before and afters, and I'm like, girl, look at the lighting, look at the lighting. And I sometimes I will do it to them. I'll be like, let's turn down the lights. Let me take a photo of you and stick your head like this, and then I will turn the light on, and then I will be like, now put your head back, and be like, look how good your jawline is. And I do anything? No. And then they get it.
It's insane.
It is insane. But another thing I tell them is like, listen, if these things could work miracles, then we should all be walking around looking perfect. If the provider doesn't look as good as they do in their photos, then that's a good sign.
Yeah.
You know,
They're photoshopping, they're face tuning.
oh, I've been catfished by so many people in this industry being like, what
I know.
is, who are you? I'd be going to someone who has overfilled cheeks and expect to look normal because their perception of reality has changed.
Yeah.
And the problem is these girls walk around and only take photos of themselves with filters. And then you look in the mirror and it just doesn't add up to them. And it's really sad. And I used to be one of those girls. I used to only take photos with filters. And like, it took like a couple of people to just make fun of me and like for me to see it. And now you will never catch me using a filter.
Yeah.
Never.
I used to also, I think it was, when did those filters come out on Instagram? Like,
oh, it was 2018. That was like maybe a little bit before then, but
so it started, everyone was using it. I wasn't into it
Yeah.
yet. And then I started using the filter.
Yeah.
I'm like, I don't even have to go out with makeup on.
yeah,
I'll just take a photo with the filter. And then it took some time to get rid of that and just use the iPhone camera.
yeah. And like, you know what?
okay.
Sometimes in certain angles, you're not going to look that cute. And you know what? It's okay. Like,
It doesn't matter.
you're
Yeah.
not supposed to.
Nobody actually cares.
You're not going to be perfect. And you know what? People are probably going to like you better for it.
Yeah.
Because I don't know how about you, but I look at people and I'm like, what the fuck are you doing? You don't look like that. Like,
I know.
it's so obvious. Like, just stop it.
Yeah.
Or this is the new style, like the jawline or even the lips, like that Russian lip. Like, it became such a thing. And like, even I remember when I started learning Russian lip technique and I started doing it, and I was like, you know what, this is not for everybody. It looks good on some people, but less is more.
Yeah.
Like for everything.
Yeah. Like, I really like the Russian lip technique.
Yeah.
But because it is the fanning technique.
Yeah.
Not because it always creates that big, juicy
No.
lip. And sometimes it looks good on some.
Yeah, I've been fanning this whole time, like since I started. But what I wasn't doing, I wasn't like pressing down, bending the needle, doing all that. And there's a place for it. Like I would say my lip filler technique is like a mix of everything. It's not like it's not a cookie cutter thing. That's why people say like, do you offer any trainings? Like, what's your technique? I'm like, I don't have a technique. Maybe I should say I do, but I don't, because everybody is different.
I can do whatever technique you want me to do, right? That's what because every patient needs a mixture of all of those.
Yeah, you're never going to use the same approach, I think.
Yeah.
If you're learning, you stick to like a little, but eventually, you mix it up.
Yeah. I even used to do Russian lips with BDs.
Yeah. You know what I've learned with the big needle. That's how I started injecting way back when. And then I started using the little BD needle. And like now I'll do like a modified Russian technique, even with the BD. Yeah.
I do mix it up.
I don't want to go that deep to the wet dry border. That's where the problems happen. I've had my occlusion and I don't want to deal with that again.
How did you know that there was an occlusion?
Well, okay, this is the thing. Like to this day, I'm not even 100% convinced that it was an occlusion, but my mentor told me like, when in doubt, take it out. So we started dissolving, and the first time you deal with a potential occlusion is always the worst, right? Because you're not sure where to start, or you're following the protocols, but you're not confident, right? So that was a really big learning experience for me. And now, I mean, it's happened twice in my career. So out of like 13, 14 years is pretty good, but it's not if it'll happen, it's when it'll happen. And you can never train or practice enough to deal with it until you actually go through it. So the second time that I had to deal with it went a lot smoother than the first time. And I'm so much more confident. Like if I'm even concerned that there's an occlusion, I'm very calm now, very chill. The client was great for both the experiences. Even when they didn't think I was, freaking out. I was freaking out on the inside, and you just have to learn how to manage that.
Yeah. Fake
Yeah.
it till you make it.
Yeah. But working in ICU will help you achieve that because you're stressed a lot and you're just like trying not to make it look like you're stressed.
What injection is your favorite? Like if you could inject filler anywhere.
Okay, so the temples has got to be a game changer for me.
Nice.
I feel like my clientele is like aging with me. Like back in the day, I was doing all the young girls, and now my clients are aging with me, and I think I'm attracting other ladies around my age, so like
Girls.
mid-30s.
You're still a girl.
Yeah.
You're saying ladies.
Ladies. No, they're definitely ladies. I actually call them boss ass bitches because
Yeah.
they're incredible. But filler in the temples can really change the way that you look without changing your face.
Yeah.
It provides that support and takes away that shadowing, and you would never know how confident it can make you feel. I love doing that.
Yeah, your temples look phenomenal.
And I had a peanut shaped head. Like it was just my anatomy.
Wow.
But it's taken a lot of work. Marco did lots of Sculptra on me.
Sculptra.
2 rounds.
Okay.
I had filler in there before, and I love filler in the temples, and I feel like sometimes you need both. But yeah, Sculptra is amazing in the temple.
Sculptra or Radiesse? And how do you choose which one for everybody?
So different. Like both biostimulators, but very different purposes. I like I like Radiesse, I should say, if I'm trying to create a jawline for those women who are starting to lose their bone here, create a little bit of a chin. I like it for straight on. For more biostimulation, I do prefer Sculptra. But I definitely feel like there's a place for both, and I definitely use both.
Yeah, because Radiesse is more firm, right? It's more mimicking bone.
Well, I like it that you do get a little bit of volumization with it as well. And I like it's versatile, like how you dilute it or blend it, as we should probably say, how we blend it. There's a little bit of versatility, but I like Sculptra in certain areas where we're just trying to create more collagen under the skin. It's a little bit more, I don't want to say forgiving, but just a little bit more gentler.
I do feel like it is very forgiving.
Yeah.
Like when people are afraid of using Sculptra, I don't understand what there is to fear.
Yeah, I think because back in the day, we were diluting it so differently.
Yeah.
And people were getting all these nodules. And there's some like controversy of like the massaging. Will people do it at home and all that? There's some homework with it. So I think it really depends on who the patient is. And if you think that they're going to follow their aftercare is really important.
Why would they not? They just spent so much money on this Sculptra.
Well, I don't know. Even me, I think I did 2 massages, but one of the doctors in the talks that I just went to said that the first massage is the most important. So I don't know, but patient selection is always key.
Yeah.
For whatever.
Yeah. I've never used Radiesse, but Marco taught me how to get rid of a nodule. So now I know.
Yeah. So I've had nodules from Radiesse done in my neck. I've had a client of mine who Marco was helping me dissolve a little bit. It definitely happens, and sometimes it's unavoidable. We're doing everything, as perfectly as we can, but it just happens. So you just have to know how to deal with complications. Like complications happen all the time, and as long as you can be confident when you're dealing with them, then that's what's important.
Yep. And not just letting your patient go out and dealing with it after you get paid. That's the worst. And I'm hearing people are doing that.
Oh, for sure. They're like, I don't see anything wrong with you, honey. You look so gorgeous. No.
Yeah. They're walking around with a purple nose. They're like, no, you're fine.
You're okay. Yeah, your nose filler should be at the side of your bridge. That's normal.
And no, but I was shocked when I found out that there are nurses that are
there's a lot of people in this industry that shouldn't be in this industry. I think especially now that we need more guidelines. I think there needs to be more regulations, and I think there should be a minimum amount of years that you have to work in a hospital. You need to have acute care experience, in my opinion, and not for the aesthetic purposes, obviously, but just for grounding someone. You need to wipe a couple of asses.
That one,
yeah, you need the humility, you need to be humbled, you need to know what's important, what's not important before you inject anybody. That's just my 2 cents.
And like you said, the acute care, it's good with dealing with complications and remaining calm under pressure. because a lot of people are freaking out about things that are, it's just filler.
Well,
Like,
yeah,
it is, it's risky.
yeah,
And we have a syringe in our hands that can, like, if we get it in the wrong place,
yeah.
and things can
But it's
happen,
not
but we
even that.
deal
Like,
with it.
think of all those things that can happen. Doesn't matter if you injected properly or not. Like, I had somebody who had a seizure in my chair, and like, I couldn't even imagine being a nurse, like, who's never dealt with that in real life. You're alone. What do, right? If you don't know how to handle things like that, or even anaphylactic reactions, like even simple things that might not have anything to do with injecting. Like, if you can't be confident doing that, it's scary.
That is scary.
Yeah.
So you had somebody have a seizure.
Yeah. I think we like came to the conclusion that he had epilepsy. It was like the worst experience. I was lucky I had actually another nurse shadowing me that day, and she was also an ICU nurse. And it was a group of men in the room. They came like all together, and then one of them shouts out, "Oh, he did this at Beyonce too." It was like before I think I just entered. We were doing jawline. I just put the needle in, and he started seizing, and I was like, "Okay, we gotta change up the protocol here." Had to deal with that. Once everything came to, he didn't want to go to the hospital, didn't want to get checked out, and
did he want to continue the treatment?
No, he didn't want to continue the treatment.
It's terrifying.
It's terrifying. Like, yeah, I know good injectors who work out of their condo,
yes.
and like they create a nice sterile environment. So I'm not saying like it's not good, but I don't like being alone.
Yeah,
I think you need someone else there with you.
Mm-hmm.
It's like safety should be the number one priority.
Yep. If you don't know what to do.
Yeah, or if you need a hand, like
Exactly.
you need someone to call 911. You need, there's, people can have medical complications like heart attack, whatever, completely unrelated. Like, how do you deal with that if you're alone?
It's terrifying. You're right.
Yeah.
Yeah, our medical history checks are so thorough, but still anything can happen.
People lie.
Yes.
People forget. Can't even count how many times like people like later, oh yeah, I'm taking this medication, or oh yeah, I have this diagnosis. It's like, that would be good to know. Yeah. Sometimes you don't find out until after, and then you have to know how to deal with that, right? It's horrible.
Oh my
But this is
God.
the industry we chose.
Somebody asked me if we can go to work hungover ever. Never.
I have before when I was younger. I won't do that again. I've done that at the hospital. We're human.
But not with injecting. I can't imagine.
Oh, I have.
I have also, but it's hard.
It's definitely hard, but I don't know. You just do it. You just do it the same way. Like, I think going hungover to the ICU was worse, but
oh yeah,
yeah, definitely. Nothing is worse, like, or more important than like actual like dying people. Like Botox and fillers, like you'll be okay.
Yeah,
you're all right.
This is not a necessity.
Yeah, you're alive. We're good. You're healthy.
Yeah.
If you weren't healthy, you wouldn't be here.
Exactly.
Right?
Some people do come in unhealthy. They're going through cancer, chemo. We don't treat them, obviously.
We don't treat them. We treat them afterwards.
Yeah. When they're in remission for over 6 months, I think.
Yeah. I always ask them to just get clearance from whoever's following them.
If you could ban one filler trend forever.
Oh, a filler trend? Ooh.
Yeah. Maybe Botox trend too.
Oh, Botox trend? I would say I would still say the overfilled lips needs to go, because that's what becomes the most obvious. But I think it's just overfilling in general. Like, everybody who is walking around with the soft face, the big cheeks, and the big chin, I haven't seen too much of that. Unless you go to like Yorkville, then you're gonna see a lot of that. But yeah.
So overfilled.
Overfilled in general.
Okay. Yeah. PRP and PRF.
Yep.
Which do you prefer, and why for each one?
I think it depends on the patient, but I'm doing a lot of PRP, or like the PRP gel. So I guess you could call it PRF, but we just started doing the gel, and I like that idea because it's sitting under the skin longer versus like you inject PRP, it's getting absorbed within a day or two max. And the PRP gel sits in there longer. So you're getting that slower release of growth factors. When we first started doing it, I wasn't too convinced, but clients were liking it. But I'm seeing that they need at least 2 sessions. after 2 sessions, they're so happy, and you can definitely see an improvement, especially in the tear trough with like the quality of skin.
Interesting.
Yeah, I wasn't a believer at 1st,
Mm-hmm.
but slowly I'm seeing the different results on everybody, and I was like, what did we do? Why do you look so good? And I'm like, oh my God, yeah, we did the PRP gel like just a couple weeks ago.
Wow.
Yeah.
And it's really good in the nasolabial folds too, right?
Yeah, I mean, it can't hurt.
Mm-hmm.
It can't hurt. I'm seeing best results with tear troughs. We were offering like a full face, and I was doing that at first, like in the temples. Now I just tell people, I don't see the benefit really of it there. If you want to fill your temples, you don't really need like collagen rebuilding in that area. You need volumization. So we need to take a different route. But for tear trough, for the improvedness like of the quality of skin or the darkness, I've seen an improvement. It's been good.
Beautiful.
Yeah.
Okay, so PRF.
Yeah.
So it does work.
The gel, yeah. I
Mhm.
mean, after 2 sessions, yeah. I haven't done too much regular PRP now that we've been doing it.
Mm-hmm.
It's like a couple $100 more. You get something that sits under the skin and lasts a little bit longer. So why not?
Okay. Yeah, I keep getting mixed responses about this.
Yeah.
So I'm just trying to formulate my own opinion from everything.
Multiple sessions.
Yeah, for everything.
Yeah. That's the only thing. And if somebody doesn't want to like commit to trying it, I'm like, well, your other option is surgery. So
Exactly.
It's up to you.
Yeah.
I don't promise anybody anything. Like some people, like, how long is it going to last? I don't know.
Yeah.
We have to see.
Everyone is different.
Yeah.
Somebody may last 1 year, other people 3 months,
Yeah.
right?
It's a hard sell. Like even Sculptra, like I can't guarantee how it's going to respond in your body. And I can't say how much it will improve. I have a good idea because I've been doing this for X amount of time and based on what I've seen. But if you want a for sure thing, you got to go have surgery. You don't want to spend $27,000? Okay, then let's chat.
Yeah.
Right?
And people are afraid of going under.
Yeah, I don't know why. I mean, it's very safe, but I guess recovery time and cost, I think, is a big factor.
Cost is big.
And also, like I always tell people with surgery, doesn't look perfect. Did you see that photo of Kris Jenner going around? I thought this bitch looked incredible until I saw that photo. I'm like, you know what? It just shows you like even surgery isn't going to make you perfect. Like you can't search for perfection. It's got to be improvements. And it's like, how much are you willing to invest in it? It's up to you. I don't force anything on anybody.
Take it, I post it.
Yeah.
I like it. It's good. Yeah, I have a little whatever. You can see my bags. You can see a line. Yeah, I have a pimple.
Yeah.
Wow, I'm human.
Yeah, exactly.
Holy.
It's normal.
Nobody cares.
No, we have to start normalizing that.
Yeah.
But it's our own fault, right? It's our industry that's creating these before and after photos. Like, just stop it.
I tell everybody, they're like, I don't like these lines.
Yeah.
But you smile a lot. This is phenomenal.
You'll never get rid of it. It's not supposed to go away.
Yeah. No, like your face is perfect. And if anybody says that this is not.
If it's not enough, I don't know. Maybe some people think that. Maybe they might think like, oh, that bitch needs to do her cheeks.
I feel like, people do other injectors give me dirty looks sometimes.
Yeah.
Because I don't have anything on my face. But
that's a good thing. Like, can you imagine when I started this, I was like 23 and like there was only like 6 injectors in the city. Oh my God. And they all looked fucking nuts. Like they were all so sweet, but like their faces were like lions. And like I remember going home and like crying, like, I don't know what if I want to do this anymore. Like I don't want to make people look like that.
Yeah. So
that's been my whole career has been to like be able to age gracefully and not make people look like that.
Natural injectables. I agree. Aging gracefully is a blessing.
Yeah.
Aging is a blessing.
Exactly. And so many of us didn't get to do that, right? It's like somebody says like, oh, my last injector botched me. I was like walking around with my brows like this forever. I'm like,
oh my God, yeah.
It's normal. It's not bad to spock. Like I even saw this other video the other day. It's like, oh, if you had bad Botox, if you're like left the brow. No, that's good. It's good. Come back for a touch up.
Yeah, the opposite is a drop.
Yeah. If you end up with a brow ptosis, then you're going to be fucked because I can't really help you.
Yeah. I think when they come in and say that was the worst injector, she bruised me.
Oh, yeah, I say that too.
I'm like, I might bruise you too.
Yeah. I think it's like comes down to education. We have to like educate and like not put down other injectors. Like I'm telling you, like working for somebody is not bad. If I had a setup like I give Marco, I wouldn't there would be zero reason for me to leave it.
Yeah.
You don't have the overhead. You don't have the responsibility, but
Yeah.
you get to make the money without all the headache.
Really good with working with other people, and you want to see them grow, which is really
Yeah,
important.
I want them to do well. I want them to succeed. Like, I don't need to make all the money. Like, to be honest, I don't have to work that much. Like, my husband, he's got it.
Love that.
But I always want my own independence, right? And my daughters need to see that.
Yeah.
Like, you can't just be a passenger princess.
Yeah.
You got to work your ass off so you're free. You can do what you want.
Exactly.
Yeah.
And how did you come up with the name, The Beauty Standard? I love it.
Oh, honestly, like, I did not open a place for so long because I didn't have a name. That was the thing. I was like, I cannot, like, even back in the day when I wanted to open a place after I left Dr. Solomon's place, I'm like, I got to open up my own place. And I was like, I can't because I don't have a name. I just came up with it one day. I was like, what's, put a couple words together and then checked if it was anywhere else. But yeah.
I love the name. And like I said, the Instagram is beautiful.
Eventually, I think people are going to get weeded out. In this economy, the people who are not supposed to be here, they're not going to be here.
Yep, I'm really excited to see what happens in a couple of years.
Yeah, it's going to be a transition.
And it's really becoming a lot of like influencers, I want to say.
Yeah.
Nurse injectors are like influencers at this point.
Yeah.
It's really strange.
It's strange. And I like, if there's a day that I can not have to be on social media, like, that will be the happiest day ever. Even though when I first started, like, I liked the idea of it, but now, like, put me back to the bedside where I don't have to go on.
The amount of times in a week that I think, why don't I just delete everything?
Yeah.
And just be off of social media and just live under a rock and just work and just don't. But then I remember it's not what I want to do.
Yeah.
There's so much more.
Yeah, there's so much more. That's the thing. So we got to adapt and do what we have to do.
But yeah, sharing life on social media,
it's hard.
Speaking of the gym, our next question is lipolysis or gym?
Oh my God. Obviously gym, but lipolysis for those little stubborn areas.
Yeah.
100%. I'm actually doing my leg tomorrow because I got a stubborn little fat pocket.
Where in your leg?
Oh my God. Under... right over here. I actually dissolved a little bit of it before, but like another one developed. So it's like,
huh. Yeah. And do you use the Belkyra or do you guys have the PCDC?
The PCDC, yeah. Yeah.
Okay.
Very effective.
The stronger one.
It's stronger, yeah.
And do you do it a lot in like what is this called? Bra fat?
You know what? We've been doing a lot just in the chin.
Submental.
Yeah.
Yeah, that's popular.
Yeah, super popular right now. And
that's the
great results.
I do. And they walk around with the swelling for a few weeks.
Like a frog.
And then they come back. Yeah, bullfrog.
Yeah. We got some really good transformation. Like, better than I expected, to be honest. Yeah. I've actually just started using it again because for a long time I'm like, oh, people got to walk around with swelling. It's kind of uncomfortable, like the tenderness afterwards that lingers. But people, they keep coming back because like they're transformed. But I'm telling you, like, we got to be really careful because I don't want you with loose skin.
Yeah.
Right? Like fixing loose skin is near next to impossible. Like, we have Sylfirm.
Yep.
And it's good, but I always tell people, like, after a certain point, you need to get a neck lift. Like, it's not gonna.
I love a good neck lift.
Yeah.
Ooh.
I love a good. I'm going for one day, hopefully soon. Yeah, I had a vagina on my neck before. I could show you the photo. It was it was a vagina.
Yeah.
Radiesse 2 times, Sylfirm 3 times, and Botox.
Just so you know, I pictured you with like your face and then a vagina.
Yeah, I don't know where my phone is. I'm gonna show you the vagina. There's the vagina.
That's what your vagina looks like.
That's what the vagina was.
Oh my God. Oh, you said the Radiesse.
Radiesse 2 times. I did Sylfirm 3 times. And I have to do my Botox. Like, I do the Botox every 6 months, not every.
You do the bands or you do?
I do the bands. No, just the bands. Like, as you can see, I need it right now.
How many units do you do in your bands?
I do about like some of them 10, some of them 8, and I only
per
do
band.
Yeah.
And you work out, so.
Yeah, but it's still okay. I do it every 6 months.
Oh my God.
Yeah,
because Marco also does it every 6 months. Can you tell me more about Sylfirm?
Sylfirm? Yeah, sorry, I'm hot. The radio frequency microneedling, and I know radio frequency microneedling has such a bad rep right now because FDA just came out with a warning, but like, And I had clients who like didn't like, am I okay? Should I do it again? And I'm like, girl, it's not the machine, it's the person doing it, right?
Yeah.
Like all of the devices, everything has an FDA warning. You think a laser that can like seriously burn your skin doesn't have a warning? It's all dependent on who does it.
Mm-hmm.
If you go too deep with too high energy, yeah, you can get fat loss. You can get potential scarring.
Yeah.
You need to go to somebody who knows what they're doing. Stop going to these real estate agents who decided I'm going to open up a skin clinic because they don't know what they're doing.
Oh my God.
Right? And like back in the day, you used to equate like pain and intensity with results, right?
Mm-hmm.
So that's probably where Morpheus got into like the bad rep place, because people who probably weren't even medical professionals got the device and they're treating people with way high energy, way too deep, right?
Mm-hmm.
But Sylfirm is super gentle. They claim that it doesn't have any adverse effects like that, but I think that it could. I'm not saying that it can. If radiofrequency microneedling could, it's all how you do it. And we do it really gently, and we take our time with it. And Dina does all of them now, and she does such a good job. Like her results.
That's the one that goes on the lids
Yeah.
as well.
And it can
It's
go
very thin.
it can go to like 0.3 of a millimeter. So it can go super like superficial, and there's great results with it. But I definitely don't promise people like you're not gonna get a facelift effect. Like, let's be clear, right?
Yeah.
But you are gonna see improvements. And I wasn't a believer until I tried it myself. Like everything I buy, I have to do it on myself. And if I see an improvement, that's why I get the machine, because like I want to treat it for myself. Like I'm going to an event tonight, and I only want to get this device because I want to treat my whole body with it.
You have the estheticians doing the lasers, right?
Yeah.
But did you ever do lasers before? And
I did the Sylfirm, but I never really focused on skincare, because I used to always think like you could just use whatever. That was my mantra until I started actually using it, and I'm like, okay, like
the story you posted, you're like, these
Yeah.
are $200 each, and they're so good.
Yeah. I used to, like, if you followed me from before, you would know that I used to promote like I'm just using the ordinary. And at the time I was. But now if I look back at the photos where I was just using the ordinary, it's a day and night difference. Like medical grade skincare, one that works for you is a game changer.
Yeah.
So I'll show you a photo of what my skin used to look like.
Yeah. I don't know. I was never a fan of ordinary. I like the pricing.
Yeah, I mean the price was good, but I feel like if you're in your 20s and you don't have problematic skin, something like the ordinary is okay, right? It's like basic ingredients. As long as you are using what you need, you're okay. It's like when we start aging, if we have sun damage, that's when you need the medical grade. Like less is more, even for skincare. The more you do, the more you probably are not benefiting.
Yeah, ruining the skin barrier.
Yeah, I have the Clarity too. It's it does pigment and hair removal, and it is fantastic.
Nice.
Yeah, I've never done hair removal until recently, and I was like, what the hell was I waiting for? Like this whole time I could have been smooth, hairless, like a baby's bottom with no irritation and no ingrowns.
Yeah.
My life has changed.
So this laser does not hurt?
It doesn't hurt. It's like, I guess the newer technology and the cryogen, Dina could explain this better. But it's very comfortable.
So it's like cooling as you go.
And it's quick. We could do a full body in like 45 minutes.
Wow.
We see best results with about 6 to 10. And then like touch-ups throughout. It depends on the type of hair that you have and your skin color. And that's another thing. It's safe for all skin types.
Amazing.
Yeah, so that's super important, especially in Toronto. Like, I don't know any like white people anymore, right? Yeah. Everybody's mixed. Everybody's got a different background. So you have to be super careful with laser because you can end up with scarring.
Got it.
I wish that there was standardized pricing.
Yeah.
So you would be, your clientele would be based on your talent and not just because you're cheap.
Yes.
Right? If something like that could happen, I think that'd be super important. And it would prevent a lot of errors.
I think we need to write all of these things down and bring it up. Yeah.
Yeah. I mean, this industry is crazy worldwide. Like some places you don't even need to be a nurse. So
yeah, like London.
Yeah. UK. Even Texas. I didn't know that.
Yeah.
Wild. Scary, but whatever.
I know. You
You be a
come out of
hairdresser.
school and yeah.
Not that
Yeah,
not
but you
that they
can
couldn't do
be.
it, but you know what I mean. Like you really need that knowledge and
People are injecting themselves at home
yeah.
with, I don't know, like from
Oh
China,
yeah, let them until they something happens,
and then
right?
they go blind.
Yeah, let them.
What do you do with patients when they tell you exactly what to do?
I tell them I say no if it's not a dose that I agree with. Like I always want people to feel like that they can advocate for themselves,
Yeah.
and I want them to be involved, especially if they want to. But I don't go to you and tell you what to put in my hair, how to do my taxes or this and that. So just trust me on this because I've been doing it long enough. Or I tell them like you want me to do this, I'll do it, but I don't want to hear any complaints. I don't want to hear anything when it doesn't work out the way you want it.
Here's a waiver, sign
Yeah.
it.
Yeah, but
Yeah.
usually I just won't do it. I'm very good at saying no, and I've
Yeah.
fired a few clients.
Yeah.
Yeah.
I love that part.
Yeah.
Like it sucks, but
Yeah.
so good.
No, it's better. Like for nurse injectors, you need to know how to protect yourself.
Stand your ground.
Yeah.
Yeah.
You really do because nobody protects us.
They will walk all over.
Yeah.
Us
There's no CNO, like RNAO. Nobody gives a shit about us.
Yeah. If you could treat one celebrity, who would it be?
Oh my god, I don't know. Who looks really crazy right now?
I don't know much about celebrities.
Me either. I'm like, who looks really crazy right now? Oh, maybe like
What about Versace?
well, she's just too far gone. What could I do there?
I don't know. You're talented.
No, like it's too much surgery. No, I don't know. Those people in Hollywood, I feel so bad for them. My girlfriend, she gets injected. She lives there. She gets injected by the doctor that did the Kardashians' nose jobs. And every time she shows me, like, is this normal? Like, this guy did that to you? How much did he charge you? Girl, get your ass on the plane and come here. Let me dissolve it. Like, it's bad. And I'm like, I think they just want to take your money down there.
Yeah, that's why people fly here to get injections.
Yeah, it's crazy.
That's all I hear, that they're using them there because they have money and fame.
Yeah, and they'll listen to them, right?
Because everyone just wants to look beautiful and young forever.
Yeah.
Just make me look good so I can continue working and making money.
Yeah, they trust it, right? Because it's a doctor. But I don't know who I would do, but I would love to do Kim Kardashian. Like I would love to do her lips. Like I think she looks great. Yeah. She probably looks different in person, but I still think she looks great.
I think she's really beautiful. Yeah. Yeah. When everybody's hating on her.
Oh, please. Go like she cares.
Yeah.
Let them.
They're just jealous.
Yeah, like whatever.
Be happy for another beautiful girl.
Yeah. The way she started. At least she started and she changed it.
Yeah. So our next segment is the rapid fire questions. So it's like this or that. Lips or cheeks?
Lips.
Nefertiti neck lift or forehead Botox?
Nefertiti.
Okay. Yeah. You see a more like drastic result?
I just think like over time, women in their forehead, like they shouldn't be getting too much Botox because it actually ages them and makes them look worse or heavier. Okay. But neck Botox, we're good to go.
Crow's feet or DAOs?
Crow's feet. Okay. Yeah.
Nice. All right. PRP or PRF?
PRP or PRF gel.
Okay. Gel. Hyperhidrosis in your underarms or in your palms of your
hands? Underarms, because I'm probably sweating right now. My Botox is due. I used to suffer from hyperhidrosis. I was like 18. I couldn't wear any colors. My sweat would be down to here. That's how the first time I had Botox was 18 in my armpits.
Oh, okay.
Yeah.
All right. And how do you feel about like 18-year-olds getting Botox? Let's say it is for underarms.
Then it's medical. It's absolutely necessary.
And what about like face and
unless they have like severe like wrinkling, like sometimes it's genetics, if they have a job that requires them to be a little bit smoother. But generally 18-year-olds I don't touch.
Mini lip plump or full lip?
I only do minis usually.
So that's the half syringe.
Yeah.
I've asked this question before, but nobody seems to have the answer. If I'm injecting filler and a little bit of it is coming out, does that mean like what does that mean when you're injecting and it like comes out, or when you squish it and it comes
out? Comes out from the insertion
hole,
point?
Yeah.
I don't think it means anything. I just mean you have the hole there and it's going back,
coming out.
It's following the path of least resistance.
It doesn't mean that it's overfilled in that area.
Oh, you're meaning like if you're injecting and it's spilling out? I think, yeah, definitely.
That means you're done in that spot.
I would say so.
That's what I think too.
Yeah, that hasn't really happened to me before.
So I've had a nurse years ago tell me, just squish it back in there.
How? It's out. You'd have to re-inject it.
I don't know. I'm not squishing anything
I feel like
back.
you'd have to, if that happened, to me, I would actually squeeze it more.
That's what I do.
And flatten it.
Yeah.
Yeah.
Because I feel like that is the time to stop injecting.
Yeah.
You're overfilling.
You're overfilled. Yeah.
Okay. So you have lots of experience. So this is our final answer.
Okay.
To stop this debate. Sculptra or Radiesse?
They're both different.
They're both different.
Yeah.
Okay. For the hair, do you ever do hair filler?
Hair filler?
Yes.
What's hair filler?
There are different hair fillers, and that's a thing.
I never heard of this.
It's like a syringe.
Okay.
Yeah, and you just inject hair filler, and it helps with. It's like a mesotherapy kind of.
Oh, like a mesotherapy. Yeah. We do Sylfirm for hair loss.
Oh.
Yeah.
What depth do you use?
It goes up to 1 millimeter, but nice. There's usually some hair on the scalp, so I'm sure it's not going that deep. It helps to stimulate the collagen, and then we top it off with exosome, and we've been seeing great results.
I can imagine.
Yeah.
Yeah, exosomes are great. Men patients or female patients?
Female all day. If I'd never have to touch a man again for the rest of my life, I'd be so happy.
Just your man.
Yeah, like any man. If I never had to touch a man again, I'd be happy.
Never again.
Kidding, love you.
Natural tweakments or bold transformations?
Natural tweakments. There's no such thing called bold transformations. You just end up looking shitty after.
The craziest patient request you've ever had?
Somebody wanted me to inject their 16-year-old daughter. Yeah.
I had that before too.
Yeah.
It meant that you would never get again. You did it and you'll never do it
Threads. I would never do that again.
Okay. Why?
Because all the things that I had to deal with it afterwards was awful. All I heard was snapping all day. Then I felt like the bar poking through caused a lot of pain. The result after 2 weeks, after the swelling went down, was completely gone. The first 2 weeks, I felt like I had a facelift. I told everybody and their mother to do it. I'm like, go get this done.
Snatched.
2 weeks, but I had a huge bruise along the side of my face, so I couldn't even show it off. Like this, show it off. But no, I would never do that again. I would never recommend it. I don't know how it's so popular in other parts of the world. I don't know if they're doing something different or have. Yeah,
I think they are doing something different because I've heard not the best results here. But how long did that pain and that weirdness last?
About 4 weeks, and every week was different. Every time something was new, I had to snap one, and I just remembered thinking, if this was I don't know how a regular person could deal with this. I'm an injector, and I was like, oh God, what's happening?
Yeah.
I couldn't even imagine a normal person.
Oh my God. Yeah, because you're not normal.
Yeah, no. I like to be poked.
Do you have anything you'd like to share with future injectors or your patients about Christmas? Anything?
About Christmas? Yeah, hurry up and book, because everybody's waiting until last minute, and I'm gonna be away. So, and I'm not gonna be sitting around waiting to do touch-ups too. We need to do it now, so we don't have to do your touch-ups when I'm gone.
Yeah.
Yeah.
So for me, what I say is 4 to 6 weeks before the Christmas.
Oh yeah, yeah.
It's already November, mid-November.
But people don't realize it, and it slips up on
the point of this talk show is for patients to see and find out more about injectors, their injector. They go through the talk show and they're like, that injector seems so sweet. Yeah. I want her to inject me, or him.
I like that.
So that's the whole point.
Oh, that's cool.
So even though I love learning and asking questions, it's so you can share more about you. Yeah. And then a patient can find you, for example, and she's like, she swears I love her.
Yeah, she swears. Yeah. I know. You know what? I'm probably not going to be taking new clients soon. I'm just going to stick to just sticking to my core, and everybody else can see Nurse Marco.
Yeah.
Yeah. Okay,
Thank
cool.
you.
You're so welcome. Thank you for having me.